Hello, my name is Todd Tester, and today I will be discussing disease and its role in the phenomenon known as colony collapse disorder, or CCD. In class and throughout lecture, we have discussed some possible factors that may be involved with colony collapse disorder. Some of these include pesticides and environmental conditions that are negatively affecting the health of the colony. Parasites such as varroa mite, tracheomite, and small hive beetle. All of these fall into the category of things that affect the colony's overall health. Parasites, especially varroa mite, are interesting because they are known to introduce many different diseases that also affect the colony, probably in the most crucial and consequential way. In addition, management problems, namely beekeepers not properly managing their colonies. This includes not treating colonies that are infected with parasites or diseased colonies. These diseased colonies are then able to spread this disease to other colonies, along with these varroa mites that are also spreading to different colonies. So this becomes a rather complex situation quickly. We note that there are many diseases that are likely influencing colony collapse disorder. Some of the most consequential of these diseases and focused on in this presentation, Nosema ceranae, Israeli acute paralysis virus, which is a virus in a larger family of viruses that are known to affect bees. Deformed wing virus, which manifests in basically adults that are useless to the colony as their wings are shriveled up and deformed. And as I mentioned, there are many other diseases that, again, anything that affects the honeybee colony likely increases its chances of experiencing colony collapse disorder. So Nosema is interesting because it doesn't manifest any distinct symptoms, at least not physical features. It is known to cause workers to forage prematurely. As we learned in class, workers in general start out by tending the brood, and then as they age they begin to forage more often. But in this case, workers struggle to produce the brood secretions that they need to feed the brood. So in this case they basically skip that step and begin foraging. And this makes it sort of difficult to manage Nosema. And in many cases, as shown in this slide, molecular techniques are needed to detect this. This is a fungal infection, and fumagellin is a common treatment for this, but it's not always effective. Some of these pictures are showing just different fungal spores, and I believe even in the bottom left panel here, on the outside you see different spore nuclei. Most of Nosema and deformed wing virus both inhabit the intestine of the bee, so this brings up an interesting interaction between these two diseases. So scientists investigating these two diseases first introduced deformed wing virus to bees, waited, let it incubate for a few days, and then introduced Nosema. And 9 days later, they found that there wasn't any significant interaction between the two diseases, and both grew relatively easily. But on the flip side, when Nosema was introduced and allowed to incubate for 4 days, and then deformed wing virus was introduced, Nosema seemed to inhibit and prevent the effectiveness of the deformed wing virus. There's it's uncertain exactly why that happens, but it still adds to the complexity of this whole situation. So the implications of this is that many of these diseases are usually found when colony collapse disorder has occurred. by testing some of the fatalities or some of the remaining brood that are existing in the colony, if there are any, which oftentimes there aren't. They also enhance the effects of these other stressors, so things like pesticides or parasites. They all seem to basically increase each other's effectiveness and likelihood of weakening the colony. And disease is just something that spreads very quickly. Many of the bees are performing trophallaxis throughout the day, so a lot of these diseases are spread in that manner, or between adult to brood through feeding. So disease is just known to spread very quickly, and as it's introduced by Varroa, it's also something that can spread between colonies very quickly. So, in conclusion, colony collapse disorder is a very complex topic, and disease in general seems to be one of the greatest, if not the greatest, effector of this, but this presentation is just here to show how complex this situation really is and why we may not have a solution for a very long time. Here's some further reading, many different papers that go into detail, some of the ones that I discussed in terms of disease interaction, along with the bottom one, which is the USDA article on colony collapse disorder and why we should be concerned about it. Thank you.